Well, a warm welcome to today's talk. It's Friday evening, the 13th of August. Things are levelling off in the UK, getting worse in the United States, especially in the southern states where there's low levels of vaccination. Australia, things are picking up in New South Wales as well, unfortunately. And there's some parts of the world that really are a concern. We're going to look at Myanmar, which was Burma today. Cases are quite high there with very limited care. And it seems to be a very similar situation in Indonesia, which of course is a much more populated country. So really quite concerning in some parts of the world, while other parts of the world do much better. Let's just look at a bit of orientation here. So the United Kingdom, United States, Ireland. Vaccination rates in Ireland will catch up with this fairly soon. They just had a bit of a slow start. South Africa in winter, of course, levelish. Canada going up a bit, and Australia, as we've said. So that's kind of roughly where we are. Don't have to look too far for the reason for this. It's all Delta variant. A little bit of Alpha variant left here in Ireland. A little bit left in the United States. A little bit of, that was the Beta variant there that was first originated in South Africa. But basically, the reason we have this bad situation now is all this wretched Delta variant. Without this, we could have been pretty well free of this pandemic by now. It's this Delta variant that's causing the trouble all round the world with its massive transmissibility, shorter incubation period, very, very high viral loads, incredibly transmissible. This is what is causing the pandemic now. Vaccinations in those countries are looking at. South Africa, very poor start and hasn't really improved that dramatically. Australia, well, for an advanced, sophisticated first world country, it's pathetic, to be quite honest. Really slow off the mark in Australia. United States going up in some areas. Vaccination is going up in some cases, in some states. United Kingdom, Ireland and Canada all doing reasonably well. And that's the figures for people that have already been doubly vaccinated. Now let's just go on and look at the United Kingdom now. Week ending the 6th of August, Office for National Statistics data. England, it was 1 in 75 people was the prevalence with it that week. Wales, it was 1 in 220, 1 in 55 in Northern Ireland and 1 in 90 people in Scotland. So that was the prevalence during that week. Now, as of the 13th of August 2021, and this is a direct quote from the Office for National Statistics, 64% of adults met indoors with someone not in their household in the past 7 days. Now, 64% there. The week before, it was 62%. So it's gone up gradually. So when restrictions were legally eased, people haven't gone mad. There's been a sort of a normal, more progressive return to normality, which of course is good. And if we look at the National Statistics latest figures here, we've got infections remain high, very useful summaries they give here. Hospital admissions decrease, deaths increase, and the graphs really say it all, don't they? It's very clear, this data. Around 3 in 4 adults are fully vaccinated. That's for adults, of course, over the age of 18, that data applies to. 9 in 10 adults had antibodies. 93.6% of adults had antibodies on seroprevalence studies, and that is accurate, that they're national studies. So 93.6% have either been vaccinated or had the infection. And it's about 18 or 90% of those that are due to natural infection. The rest is due to vaccination. And we know that from the type of antibodies that can be differentiated between those generated purely by the vaccination and those generated by the natural infection. And we also see that happiness is around about where it normally is, which of course is somewhat subjective, but it is very well collected data. So you could spend ages browsing this site. There's loads of interesting stuff on it. Here we see the latest figures from the government site. Daily cases actually up a bit in the last 7 days. Positive tests up a bit. Patients admitted to hospital though down a bit, which of course is good. So cases, looking at the graph there, if we look at let's look at date reported. So we are seeing a gradual increase in the last few days. I think we're on about 30,000 new cases over the past, 23,000 cases there That's right, 33,000 cases in the where that data is reported to. But healthcare-wise, the situation is not great, but the point is it's manageable. So 750 patients admitted, but they're often not staying for as long. So the number of admissions is down, and the number of people actually in hospital is going down gradually as people are staying in hospital for less time, which is good news. And the number of people in intensive care gradually declining as well. Vaccinations in the UK really not quite what we would hope for. I mean, these are the number of first doses, so they're going down quite dramatically now, and the number of second doses not where we would like it to be, as younger people are getting vaccinated less than we would like to optimise the immunity in the country. So that's a review of the United Kingdom. The United States now. 90% of counties in the United States with high or substantial transmission rates at the moment. 93 million people in the United States not vaccinated who are eligible, and the pandemic is essentially in this 93 million people now. Very largely in that 93 million people, or those that have only had one dose of vaccine so far. The amount of virus spreading around means that mutation could still occur. There could be further mutations. Dr. Fauci pointed out that measles, smallpox and polio have been virtually eliminated with universal vaccination, and is advocating the same for COVID-19. Hospitalizations up a bit over the past week. Florida and Texas, 40% of hospitalizations. And as we'll notice I want to talk about children in a minute in the States, but just before we do that, Florida and Texas, 40% of hospitalizations at the moment. And then we'll come on to talk about that related to children in a minute. But let's just look at some data from the United States first of all. So number of COVID-19 cases, so that's the number of cases in the country, clearly an upward trend. And I'm afraid from memory deaths is much the same. Daily deaths there. It is edging up in the States, isn't it? So we're looking at about 700 deaths a day, that kind of region. Now, this is the vaccination status in the States. Now, this here is very useful. This is for the United States, and we see that the overall vaccination level is going up slightly. But what is encouraging about the United States, I just looked at a couple of states here that were lowish. So if we look at Mississippi, for example, if it's going to give us this data. So yeah, we see that, for example, vaccinations in Mississippi are going up really quite dramatically as people seem to realise the need of this. Or another state, for example, that was very low in vaccinations was Florida. And if we look at what's happening in Florida, again, we see that the vaccination rate is picking up. So this is pretty good news. It is picking up now, but of course there's going to be a delay. At the moment, we're suffering from quite a lot of increased hospitalizations in the States, prevalent hospitalizations of patients with confirmed COVID-19 in the United States, and we see quite a dramatic rise. And as we've said, 40% of these figures are accounted for by Florida and Texas. But good to see these states that were so behind in the vaccination states catching up. But of course, it will be quite a delay between the vaccines, and then we need to wait for 3 weeks after the second vaccine. So we've got a delay. Now, in terms of children, is a bit of a concern in the United States. Respiratory syncytial virus surge in a heat wave. Now, respiratory syncytial virus, very common virus. You get it all the time in children. Most children get very mild illness. Even since I remember when I was young, we used to get a few children in hospital with respiratory syncytial virus. It's always been a few people got sick, but not many typically. But now there's a surge of respiratory syncytial virus in the middle of this terrible heat wave you're having in the States. Whereas normally, of course, it occurs over winter. It's normally associated with influenza. So RSV high at the moment. Another virus called Parainfluenza virus also high at the moment, another respiratory virus. And it could well be that it's the combination of respiratory syncytial virus plus COVID, or plus SARS coronavirus 2, and parainfluenza virus plus COVID, that is causing more children to get more sick more quickly. This seems to be what is happening. Now, the data on this is not firm, but it's being reported from all around the country. And of course, it's not impossible that some children could have RSV, parainfluenza and SARS coronavirus 2 at the same time. And add to that the incidence of still people trickling in, unfortunately, children trickling in with multi-system inflammatory system in children 2 to 6 weeks after infection. So we've got more RSV, we've got more parainfluenza. Immunity from those is lowered as a result of the lockdowns and children not interacting as much. Now children are back at school, and it could well be that it's having several viral infections at the same time that's making a higher proportion of children sick. Or it could be something that's more pathogenic in the Delta variant that's making children more sick. We don't really know. The data can't dissect this yet. My best guess at the moment is it's the combination of SARS coronavirus 2 Delta variant with respiratory syncytial virus or with parainfluenza virus that's making more children more sick. Certainly a way higher proportion than in previous waves. So 1,785 children, that was actually the Thursday figure in hospital in the United States. Florida, there's 247 children admitted last week to hospital. Nearly all the parents of these children are unvaccinated, and most of the children themselves are unvaccinated. So how many of these parents are looking at their children in hospital now, wondering if I had been vaccinated, would my child be suffering in this hospital bed right now? It's an interesting idea. Or if my next door neighbour had not been demanding to exercise his constitutional rights of freedom and not be vaccinated, would my child be in this hospital bed now? This is the reality of the situation. So children are either under 12 or teens who've put off vaccination. Of course, only vaccinating up to under 12 not being vaccinated in the US at the moment, of course. Right, long COVID in children, this data here, again, indicating that this is happening even after milder asymptomatic infection in children. So this could turn out to be a bigger problem as a result of what's going on now. Michael Smith, Children's Hospital Los Angeles, relative specialist. Vaccinations for 5 to 11-year-olds, talking about that, are delayed till the end of this year, we believe. We've got months to go. We're in real danger. We're in a real danger period between now and then. So paediatricians here really quite keen that younger children get vaccinated. And as we said, it could well be a combination of this parainfluenza virus and this respiratory syncytial virus that are essentially catching up, infecting people that they would have typically infected last winter. Australia. New South Wales is the epicentre, of course. Another 390 cases in the past 24 hours. That's the total number of cases in New South Wales since the start of the pandemic. That's the number of locally acquired cases in New South Wales since the 16th of June, which was when the first case of this current wave was identified. 6,874 locally acquired cases in this wave. 140 linked to known cases or clusters, so they can be sort of got on top of reasonably well. 118 are household contacts, 22 are close contacts, so they can be contained to a large extent. Source of infection for 250 cases is under investigation, so they're not yet contained and their contacts are not yet contained. 58 cases were infections in the community, so this is the level of real community transmission that we're worried about, but we see it is happening. And of course, these people would be infectious before they were diagnosed. Isolation status of 191 remains uncertain or under investigation. So we can see the New South Wales contact tracing people are working pretty hard at the moment, but they still haven't done the whole job. Because 191 remain under investigation, which of course is a lot with the Delta variant. Deaths, another 2 deaths. Man in his 90s, very concerning. A woman in her 40s has died. That is very sad. Deaths in the current outbreak. There was 38 in the current outbreak and 95 altogether, again in New South Wales for the whole pandemic. So 38 in the current outbreak. In hospital, 391 in New South Wales, 63 in intensive care, 30 on ventilators. Now, regional sewage in other parts of New South Wales outside the Sydney area. Regional sewage systems in these areas. So these are various more rural areas or regions in New South Wales, not in Sydney conurbation as I understand it. Do correct me, Australians, if I'm wrong. But the point is that the virus has been detected in the sewage in these areas of New South Wales, and there's no known cases there. So what this means is that in those cases, the virus is being detected in sewage, so the virus is there, but no one's been diagnosed. So presumably no one is taking special isolation measures above and beyond the normal restrictions that are in place for New South Wales anyway. Government territories, of course, now in a 1-week lockdown as well. The Canberra area, from an unidentified case or 2 in Canberra. So this is a concern. This does mean there's probably some spread in the community that is not recognised, being picked up in the sewage. There's 420 testing locations across New South Wales. Don't remember, get tested if you have headache, runny nose, sore throat, sneezing, common cold type symptoms. And this is well publicised in Australia, your nearest clinic for testing, and you can click on that one if you want to get to it. Right, so it's really getting quite hard to see that this is going to be eradicated now in New South Wales. Really getting quite hard to see that, I think, now, and it just shows the importance of ramping up the vaccination programme there. Now, just a brief report. I have got a few contacts in Myanmar, in Burma. Can't say more than that, obviously, but just some information from Myanmar anyway. Yellow flags are being flown out of people's windows because they have a sick person inside and they can't get them to hospital, and they fly a yellow flag out the window hoping a passing doctor or nurse will go in and help them. So that is pretty pathetic, that people are having to fly yellow flags to appeal for medical help. Many deaths at home, people can't get into hospital. Serious oxygen shortage, even in Yangon, Rangoon, worse than the rural areas. United Nations say 40% of the healthcare facilities are currently functional. Put that another way, 60% aren't working. And they weren't brilliant to begin with, and they're 60% down. A lot of people are dying at the moment who would be quite savable with even basic medical care. And they're not getting it in many parts. The majority, from what we understand, are not getting it. Quite tragic situation. Oxygen production is channeled through military hospitals. So it looks like the military clique, the elite in the military, who about 1,000 of them we believe who are governing the country, essentially dictators, are getting oxygen. DIY home care. People are just doing their own whatever they can. Local doctors are working locally rather than working through government hospitals, military-run hospitals. Healthcare workers have been arrested. It's actually doctors and nurses and medics that have actually led a lot of the passive resistance in Burma to the government, the military dictatorship. But it really couldn't have come at a worse time. And backlog at crematoriums as a lot of people are dying at home. I mean, what this means really, that the 5% that were hospitalising in the UK, probably half of those, more than half of those, could well die in Burma. So we could be looking at infection fatality rates of 2 or 3%, which of course is quite tragically higher than in areas where people have been able to access the medical care that they require. Often fairly minimal medical care, maybe just oxygen, maybe anticoagulants, maybe steroids for a short period of time, maybe a course of antibiotics if there's secondary infection, and then they go away and live the rest of their lives in the majority of cases, and that is not happening. So a bit of a repeat of the India situation of a month or so ago in Myanmar. And it's hard to get the news, and the rest of the world doesn't seem to be doing too much about it, which is pretty tragic. I've been to Burma recently, and I've worked with Burmese people in the north of Thailand, and very open, wonderful people. It really is very multi-ethnic, many people groups in Burma, and it's sad to see that so many are suffering because of the military political situation there. But unfortunately, a lot of people dying unnecessarily. Okay, so that is us for today. Thank you for watching if you've stayed to the end, and if you only watched for the first bit, thank you for watching anyway.